Hello, I'm Dr. Sri Banerjee, Core Faculty for the College of Health Sciences and Public Policy at Walden University. In this video or audio clip, if you're listening to my podcast, this one will be going over big data health and applications of precision public health. So let's get this first straightened out. One of the things that a lot of people have confusion over is how can precision medicine be public health? It seems to be on different sides of a continuum. But I would argue, and what this paper is arguing, is that we can still have big data and be able to apply that in precision public health. It's somewhat challenging, but if you understand the underpinnings of this, then you can better understand how big data meshes well with public health, precision public health. So here we go with big data has enabled more widespread and specific research and trials of stratifying and segmenting population at risk for a variety of health problems. So the examples of success using big data are surveyed in surveillance and signal detection, predicting future risk, targeted interventions, and understanding cause. So the novel big data or big data approaches has risks that remain to be resolved. Okay, so that's in the abstract. Let's take a look at the introduction. Of course, this is a review article, so it aims to identify the precision public health use cases where big data has added value. And then they go into some categories which are interesting to look at. Of course, here's the search terminology that was used. And then here's the big data in public health. And big data has recently become a ubiquitous approach to driving insights, innovations, and new interventions across economic sectors. So the U.S. National Institute of Standards and Technology defines big data as follows. Now, this is important. Big data consists of extensive data sets, primarily in the characteristics of volume, variety, velocity, and or variability. And this is known as 3 V's or 5 V's, or in some places there's variations of that. And I talk about it some in one of my books. And then, so there's the, let me read this again. Big data consists of extensive data sets, primarily in the characteristic of volume, variety, velocity, and variability that require a scalable architecture for efficient storage, manipulation, and analysis. So decrease in cost of technology enabled the big data phenomenon to even emerge. Data of such a high volume, velocity, and variety to require specific technology and analytical methods for its transformation into value. So I don't want to read all of this, but it goes into each of the V's, volume, variety, and applying it in different disciplines, which is very important. And I think this is something that it's worth your while to go over. And then it goes into specific diseases, Lyme disease, which I talk about in my other book, influenza A, H1N1 variety, and then electromagnetic field exposure, drowning, drug safety. All of these were looked at for disease surveillance, signal detection, and more importantly, precision medicine public health. Precision public health. So they talk about Google Flu Trends, which is no longer, I wouldn't call it a failure, but no longer is not needed due to the fact that trends in itself are being replaced by that. So I kind of disagree with that part of it, but nevertheless, this is something so applying treatment interventions to homogeneous cohorts within a large heterogeneous population has been advocated since Lalonde's seminal report, A New Perspective on the Health of Canadians, in 1974. So historical examples of adding precision to public health treatment populations include gonorrhea in the 80s, HIV in the 90s, breast cancer in the 2000s, and malaria in 2010. So this whole population, as many studies considered a cohort in and of itself. So in 2010, the U.S. Department of Health and Human Services said of those citizens with multiple chronic conditions, indeed developing means for determining homogeneous subgroups among this heterogeneous population is viewed as an important step in the effort to improve the health status of the total population. So big data has been leveraged in public health research, identifying finer grain treatment interventions in childhood asthma, childhood obesity, diarrhea, hepatitis C, HIV, injectable drug use, malaria, opioid medication misuse, use of smokeless tobacco, and the Zika virus. So here's the thing here. When you say precision medicine, precision public health, there's this kind of alarm that you see in people's faces that how can you be talking about precision public health when public health is about populations? But the reality is, when you understand the subpopulations better, then you can go back and apply this in research in a more powerful way. So there's an importance of having targeted treatment for population level too, because you have to apply this in a local level. I just wanted to, before I end this, I wanted to go over some of the contributions of big data, and this table 1 is really informative. And then table 2 goes into a little bit more detail about precision public health discipline, and I really think this is worth your while to go over this table. Of course, with data, the lack of clinical data, lack of attempt to build data sharing agreements, the lack of attempts to use other methods to add phenotypic data. So no addition or traditional surveillance approach data to test incremental improvement in hybrid approaches. So this is predicting risk, targeting treatment interventions, and then understanding disease. And then this goes by study attributes, data, subjects, geography, and scaling. So across and down, you can look at subjects. There's children not included either by design or due to big data constraints. Privacy risks not addressed as precision increases. Subjects could be uniquely identified. And then lack of N, and so predicting risk. Geography study was conducted in a site, and then scaling. So that sums up what is in this paper. There's a lot of things, and then risks that they talk about within the paper. And then there's a lot of good information that is beyond the scope of its talk, but really important. This is in Frontiers in Public Health. The title of this article is Big Data's Role in Precision Public Health, and was published by Sean Dolly. Again, very good information within this article, and I really recommend that you use it. Thank you for listening.